Hi everyone, I'm so happy to join you for the MIPS 2021 conference, and I wish we were all seeing each other in person, but it is what it is. And I'd like to thank Dr. Risk and the organizing committee for enabling me to share patient voice at this conference. I have no disclosures to share. Impact to intimacy related to pelvic organ prolapse is the topic that I'm going to be addressing today. And I would like to dig a little bit deeper into the impact to quality of life that this most significant topic creates. Women's health certainly should include sexual health, and often a physician's idea of POP quality of life impact is a little bit different than the patient's idea of quality of life impact. And in order to truly define treatment success, we need to incorporate sexual health, and we need to recognize and acknowledge that women do enjoy sex, and it is a big part of our reality. So in today's presentation, I'm going to share with you 7 of the top impacts to intimacy that prolapse creates. There are obviously many more. This is not an all-inclusive list, but these are the 7 that sift out to be at the top of the leaderboard for the women that we serve. So at the very top is vaginal tissue bulge, which is obviously the most common symptom of prolapse. And women find this the most invasive. You would think that fecal incontinence would be more bothersome to women than that tissue bulge, but it's not. The visual that vaginal tissue bulge creates is very, very bothersome to women. And they are so worried that their partners are going to be turned off if they see tissue bulge. And as a result, it has a huge impact to their relationships. Vaginal pressure is extremely prevalent with prolapse, and some describe it as pressure, some describe it as pain. It's extremely variable from woman to woman. But I kind of equate it to stuffing the toothpaste back in the tube. And when you have that sensation of pressure all the time, and when you're attempting to engage in intimacy, particularly if you're engaging in any position other than missionary, it can be very invasive for you. And it's kind of a roadblock for women being intimate with their partners and being creative with their partners, which may be something that they're used to doing and now they have to ratchet back on. Pain with intimacy is really quite common, and all too often women are advised by their clinicians that POP does not cause pain, and that is such a misconception. If you just think about it, those organs are displaced, they're putting pressure on soft tissues and nerves because they're positioned where they're not supposed to be, and everything's all kind of mushed together in that pelvic space. And women can experience just the discomfort of the bulge itself, that pressure sensation, the irritation that is occurring because that bulge of tissue is rubbing against the undergarments. There can be rectal discomfort, there can be pelvic discomfort, there can be back pain, which is certainly common with an enteral seal. And any of these types of pain are bothersome, and if women explain this to their physicians, they may be poo-pooed. If they explain them to their intimate partners, they may be looked at like they're half crazy. So it's just important that we recognize and acknowledge that pain does exist with prolapse. Chronic constipation is a huge barrier for women that have a rectal seal. It's their all-day, everyday companion. And your colon is always full of fecal matter, which of course also creates gas because it's not passing through the body. You kind of feel like a stuffed sausage, basically. And women swear they would give their firstborn male child to have a normal bowel movement every day when they have a rectal seal. They experience a considerable amount of discomfort, and they experience incomplete bowel emptying. If they do have a bowel movement, it may be just raisin size stool and just a little bit of it. So they always feel like they have to poop all day, every day. And considering you never really know what time of the day or when the opportunity is going to present itself to have intimacy with your partner in today's busy world, this is a bit of a roadblock as well. Urine retention is something that we don't talk about nearly frequently enough. in the POP space. We talk about incontinence all the time, but the flip side of that is the urine retention. And women have got to pee. They certainly want to pee, but that pee won't come out. So to give you a visual on how this impacts intimacy, imagine, if you will, that the bladder is holding 800 cc's of urine, and you've got a uterus sitting on top of that bladder, creating pressure, possibly a rectal seal bulge coming from the backside, creating additional pressure. And now, when you're engaging in intimacy, you've got a penis doing that into that gluck of organs and space. It's not very comfortable. Coital incontinence is a big deal in our space. It doesn't get talked about very comfortably or very often, but when it comes up, it creates a lot of dialogue. Urine or stool leaking out during the act of intimacy is a big deal. And obviously the urine leakage is not quite so noticeable, especially if it's in small amounts, but stool leakage, there's no missing it. It's glaringly obvious when that happens. The visual and the odor are very, very noticeable. And when this happens, women are so devastated, and the men may try to make them feel it okay, it's not that big of a deal, don't worry about it, but it haunts the women for days after it happens, and very frequently they do not return to intimacy. They're just done, they shut down. They will not risk it happening again. It takes a lot of counseling to get these women to get past that stigma and to try a few of the tools that we suggest to move past this great roadblock of intimacy. Lack of intimate sensation is a much bigger deal than is recognized. For women that are freely orgasmic before prolapse occurs, they are hugely frustrated and would give anything to get back to that degree of intimate sensation again. And it's one of those things that if they're used to having and they lose, even if it's not a matter of losing orgasm altogether, it's just a matter of reduction in sensation or intensity, their mind's going to start to wander sometimes when they're being intimate. And it may be a situation where they're thinking, oh geez, I could have gotten 2 loads of laundry done. They're totally away from the intimacy page, and that's bad for relationships as well. So I put together a survey to try and figure out which of these impacts to intimacy are the most bothersome to women, and I included 12 impacts to intimacy. These 3 floated to the top. There were 141 women that responded to this survey. And at the top of the leaderboard, obviously, there is that embarrassment of your partner seeing your tissue bulge, which I mentioned is most significant to women. And that was at 52% of women that came in with that. So it's a large percentage of our following. And actually, all 3 of these came in at large percentages. And 43% of them were in high states of anxiety about pain occurring during intercourse. So once they've experienced that pain one time, they have a hard time getting past it reoccurring. And then that loss of intimate sensation, which I was surprised to come in the top 3, but it did. It is bothersome to women as well, and that was at the 42 percentile. So I went back into our patient following then, and I asked them to submit to me some direct quotes that I could share with you in this presentation. And our ladies always come through for me, and they shared these following 5 quotes, which I cherry-picked out of the ones that they submitted. The gaping vagina with organs peeking out. So the gap gets talked a lot about in our space. The gap is that vaginal stretch space that occurs after women have given birth vaginally. And now you not only have the gap, but you also have those organs peeking through in the middle of that gap. And women are very stigmatized by this. They don't want their partner to see this. They don't like seeing it themselves. And they will rather avoid intimacy altogether than risk their partner seeing this. So if they're a couple that's normally used to engaging in oral sex, and this is a huge roadblock for them, but even just engaging in intimacy in general, it's very bothersome to women. Pain in any position other than missionary, and the complete loss of sensation. Now, at the surface, this may seem like a conflicting couple of symptoms, but it's not. They can both occur at the same time. Women obviously can have pains from from the displacements of organs and the dysfunction that's occurring within those organs. And loss of sensation is clitoral based. So they can experience both at the same time, and that this woman submitted them both in one quote pretty much says it all, I think. And having a rectocele makes me feel like I'm going to have a bowel movement as soon as we start. It's a turnoff to take time out to do an enema prior to intimacy. So imagine that you're engaged in an intimate initiation, and the woman says, she realizes, okay, her significant other is serious. He wants to get a little whoop going on here. And she has to say, excuse me, I'm just going to go freshen up a little bit. And goes in to consider doing an enema because she's so worried she's going to have a bowel movement during their active intimacy. And an enema does not take 1 minute. You know, you're looking at 10 minutes you've stepped out of the room. And is the mood going to be the same when you step back in? Probably not. So this is a bit of a barrier for women that have got concerns about rectocele, constipation, or concerns about having fecal incontinence for that matter. The fear of losing urine or feces if I have an orgasm. I was really glad that this woman sent this one in because I had never heard it before and it had never occurred to me before. So I dug a little bit deeper. She's in her 30s, and here's a woman who loved her partner passionately, loved engaging in intimacy with him. She was doing everything she could to be proactive, finding non-surgical treatments to address her prolapse because she did not want to have surgery until she was done having children, and was able to get to an orgasm state. Good for her. Good for her. But she had to hold herself back because she was worried that she would lose urine or stool during that orgasm. Talk about a mood breaker. That is just so unsettling to hear. And this one I love. The betrayal of your body goes to the very core of your sexuality. Because of the impact to self-esteem, nearly all women are impacted in this respect. This is one of the main reasons that we grieve. So this impact to intimacy, this impact to sexuality is an aspect of POP that needs a lot more exploration, understanding, dialogue, and certainly questioning during screening process to bring it to the surface. So it's imperative that we all initiate the conversation, both sides of the equation, the patients and practitioners. Patients have multiple quality of life concerns, but for those that are more stigmatizing, they don't always openly share them completely, candidly. And physicians are optimistic that they can address patient needs, but don't always ask the right questions. That's a concern. So it's imperative that we do everything we can to initiate a more proactive stance in intimate and sexual health assessment, and it should be included in all POP screening. Ask the right questions. I encourage you all to continue the great work that you do. I encourage you all to explore deeply and ask those right questions of your patients. If you're not paying attention to the shift that's going on now in women's vaginal health and sexual health, along with pelvic organ prolapse, you're not paying close enough attention to the energy that's occurring out there. There's a significant shift that's been going on, certainly stateside, but from what I'm seeing in the European and the Asian and South American sectors, it's going on there as well. In all of these spaces, talking out loud more about these issues. I'd like to see a lot more on the prolapse side, and I'm certainly banging the drum louder than ever before and encouraging all practitioners to engage in open dialogue in this space. Know that every effort that you're making is priceless to create awareness of these issues. But more valuable than that is how comfortably you share your voice and lift these issues up into a visible space outside the closet in open dialogue with women and with media and with everyone you can to help women recognize that they're not alone in these issues. I thank you all for everything you're doing and encourage you all, stay the course.